Dry eyes. Dry eye is a frequent condition that arises when the eye does not receive enough water. As a result, tears may be insufficient or unstable for a variety of reasons, leading to inflammation of the eye or damage to the eye's covering. Dry eye is a discomforting disease in which the patient experiences burning or itching in the eyes in a variety of conditions, such as at the airport, in an air-conditioned room, or when sitting at a computer. Dry eye relief can be achieved through a variety of home remedies in addition to pharmaceutical therapies. Dry eye signs and symptoms. The following are the signs of a patient with dry eyes. A burning sensation in the eye, along with pain and dryness. A sand-like sensation in the eye. Mucus formation around the eyes. Smoke or wind sensitivity in the eyes. Eye irritation. Difficulty maintaining eye contact. Experiencing eye fatigue after reading, even if only for a short length of time. A pair of binoculars. Light sensitivity. Constant weeping. Seeing double. When you wake up, your eyelids stick together. Contact lens wearers may have eye pain. Dry eye causes and risk factors. The following are some of the causes and variables that contribute to dry eyes. 1. What causes dry eyes? Fatty oils, aqueous fluid, and mucus are the three layers that make up the eye. These substances keep the eye moist and pure, and no dryness is caused by any of the layers. The following are the most common causes of dry eyes. Tear production is reduced. When the eye cannot produce enough aqueous fluid, dry eye develops. This condition is known as keratoconjunctivitis sicca, and the most common causes are: 1. Growing older. 2. Sjogren syndrome, allergic eye illnesses, rheumatoid arthritis, lupus, thyroid disorders, and vitamin A insufficiency, to name a few. 3. Drugs such as allergy medications, decongestants, hormones, depression medications, and some forms of high blood pressure medications are also used. 4. Corneal nerve sensitivity as a result of wearing contact lenses or having laser eye surgery. Increased tear evaporation. The oil duct on the edge of the eyelids becomes blocked for the following reasons. 1. Blepharitis of the posterior eyelids. 2. Lack of eye blinking, which can happen when you have Parkinson's disease, are driving or reading, or are seated at a computer. 3. Eyelid issues, such as the presence of an outward-facing eyelid or an inward-facing eyelid. 4. Sensitivity to light. 5. The drops contain preservatives. 6. Dry air, smoke, or wind. 7. Vitamin A deficiency. Dry eyes can be caused by multiple factors at the same time. 2. Potential dangers. The following are the primary factors that enhance your chances of getting dry eyes. Age. Dry eye is more common in those over the age of 50. Gender. Women are more likely to experience dry eyes, especially during hormonal changes such as those caused by pregnancy, contraception, or menopause. Consuming a poor diet deficient in vitamin A and omega-3 fatty acids. Contact lenses. Using contact lenses exacerbates dry eye syndrome. Eye problems caused by dryness. The following are some of the most common side effects of dry eyes. Infections of the eyes. Tears protect the eye from germs, thus if the eyes are dry, the risk of infection increases. Damage to the ocular surface. Untreated dry eyes can lead to inflammation, corneal erosion, ulcers, and vision loss. Poor quality of life. Dry eyes make it difficult to carry out regular tasks, such as reading. Dry eye disease is diagnosed. The following tests are used to diagnose dry eyes. 1. A thorough eye examination. Dry eyes can be diagnosed with an eye exam that includes a comprehensive eye history. 2. Counting the number of tears in one's eye. This is done using the Schirmer test, which involves placing strips under the lower eyelid for 5 minutes and then measuring the strip wet with tears to determine the degree of dryness. The phenol red thread test is another method for determining tear volume. The volume of tears is measured when a thread filled with a pH-sensitive dye is put on the lower eyelid and wet with tears for 15 seconds. 3. Tears quality evaluation. Eye drops containing dyes are employed in other procedures to assess the state of the eye's surface. The doctor examines patterns of corneal darkening and time taken for tears to dissipate. 4. Osmolality test of tears. This test evaluates the components of tears, including particles and water, and the percentage of water in dry eyes is lower. 5. Tissue samples. Tears are collected to determine the reason of dry eyes. Therapy for dry eyes. The following procedures are used to treat dry eyes. 1. Using synthetic tears. Eye drops are the most common therapy for dry eyes since they help to hydrate the eyes. Many people find that artificial tears are effective. 2. Eyelid plugs. Tampons may be used by your eye doctor to close the tear drainage pores in the corners of your eyes. This technique decreases tear loss and is relatively painless and reversible. 3. Medication usage. The most frequent treatment for dry eye syndrome is cyclosporine, an anti-inflammatory that helps enhance tear production while lowering the risk of corneal damage. Corticosteroid eye drops are used for a limited duration in cases of severe dry eyes. Cholinergic medicines, such as pilocarpine, are an alternative for dry eyes. These drugs aid in the production of tears. If the prior therapies fail, the doctor may examine different treatments that are appropriate for the disease's etiology. 4. Surgery. In certain situations, despite the use of all previous drugs, dry eyes persist, and the doctor must resort to surgery. The tear drainage channels at the inner corners of the eye are permanently blocked after surgery, allowing the eye to conserve enough tears. 5. Natural treatments. If you have dry eyes, you should do the following steps. Keep the room humidified and away from the dry climate. Avoid wearing contact lenses until the dehydration is resolved. Spending less time in front of the TV or on the internet. Dry eye syndrome prevention. Follow these guidelines to avoid dry eyes. Avoid direct air exposure, such as from a hair dryer or house air conditioner. Use a humidifier to boost the room's humidity, especially during the winter months. When going outside, wear sunglasses to avoid being exposed to dry air. Take breaks from long work, such as reading, to allow your eyes to rest. Lower the computer screen to below eye level to reduce glancing up and keep the eye drawn for longer. Make an effort to quit smoking. If you have chronic dry eyes, use artificial tears on a regular basis. Try to close your eyes for short periods of time, especially in dry surroundings like the desert, airports, or high altitudes.